Hello, my name is Tashaundra Bailey, and I am a speech language pathologist at a long term acute care rehab facility in Nashville, Tennessee. Today, our presentation will focus on our older adults, our dementia and Alzheimer's population, as well as swallowing. I want to give you ways to identify if your loved one may show signs that they may have dementia or Alzheimer's. And also I want to help you to identify if they have a swallowing problem. I'm also going to give you strategies that will help you, and hopefully you'll enjoy. Our first question is, what is dementia and Alzheimer's? A lot of times when we say this, we use it interchangeably. But actually, Alzheimer's is a type of dementia. Dementia is a group, so it's a group of the symptoms and effects. It's like an umbrella effect of things that someone will be under. And then Alzheimer's, it's an actual disease, a progressive disease of the brain that reduces their memory and their cognitive abilities. If you take a look at the normal brain, you see that all of the sulci are filled in. You don't have any holes, no holes here. But as we go and we look at the dementia patients, they have holes in their ventricles and also holes here in the hippocampus, and that is where your memory and your cognitive abilities and your executive functioning tells you what to do and when to do it and how to do it. So with these dementia patients, they are all showing that their brain is basically shrinking. And so when they start to forget things and say things that are out of the ordinary, it's not their fault. It's because their brain is shrinking and they can no longer hold all that information. So these are ways to recognize signs and symptoms of dementia if you are experiencing this with your loved ones. If they are starting to struggle to remember recent events, and things from the past, but they remember things from the past, or finding it hard to follow conversations, always asking you, what did you say? Or they forget names of friends and families and things that they do every day. Also, they may forget what you're talking about and ask you to repeat yourself numerous amounts of times. They may have problems thinking and reasoning through a problem. They may feel anxious and get depressed or angry and strike out at you because they are forgetting certain things. And you're not understanding because you think they're the same way that they have been. But in actuality, their brain may be shrinking because of the dementia. They may also confuse you with somebody else. And then they'll laugh it off like, ha, 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 oh, I knew. So that may be a sign. That's a red flag. And they might also decline in their ability to talk. So if you see any of these signs and symptoms, make sure you take note of it. And if it's consistent, you may need to ask them to say something to their PCP or their doctor. When you're caring for someone with dementia, Alzheimer's, so let's say that they've already been diagnosed and you're taking care of them, or they have a caregiver that is helping them, you may want to correct yourself. You may need to correct your body language because it's important and they see all of these things within you. Make sure you stay positive and have a good attitude. Try not to sigh or roll your eyes in front of them because this may trigger a behavior. So many times we hear about our seasoned adults wandering out or leaving from the place that they know of. That's because maybe something that somebody did or something happened triggered them to want to leave the presence of that place. Make sure you speak slowly. Use simple words. You can't speak too fast because then they're going to ask you to repeat. Try to use lower tones. With our elderly population, the higher pitches of sound are the first thing to go. And so if you speak really high, they're not going to hear you. So make sure you reduce your anxiety, you reduce your tone, and allow them to process what is going on. Ask simple questions. Yes or no questions are really easy for them. So try to form the question in yes or no. Also, again, be prepared to repeat. Respond with reassurance. Make sure that you understand what they're saying. And if they ask you a question, answer it. Allow them to remember the good old days. So remember, if they say something and they've said it 35 times, still listen to them and understand what they're going to do. And try not to ask too many questions at once. Be patient. It's going to take time for them to process it. So if you ask them a question and they do not answer, make sure you give them time to process it and then give you an answer. And also make sure you keep a sense of humor. They love to be silly and they love you being silly, and it makes them feel at ease when they know that you're relaxed, then they can relax. Other ways to help within the household is by keeping or making schedules for someone. So say they've been diagnosed or that they're staying with you now. A good way to make it through the day is to make a schedule. So here I put up a sample schedule of the day. You would do like a morning routine. So you would do morning ADLs. You would prepare and eat breakfast. You'd have conversations over coffee. Discuss the newspaper with them. That way they'll maintain their orientation to what's going on. Make sure that you tell them the day, the month, the year, every day. Take breaks. Do chores together with them. Go for walks or play active games. Prepare or eat lunch. Read mail. So that's a good activity that you can do in the afternoon. So while you're preparing lunch or lunch is being prepared, you all can walk out to the mailbox, or they can walk out to the mailbox to get to the mail, so that when they come in and eat lunch, you all can discuss the mail after eating your lunch. And then you can have them wash dishes, which is going to be a part of their routine for every day. You can also listen to music or do crossword puzzles and watch TV, and also schedule a nap. Make sure you you schedule a nap within your schedules. In the evening time, you could prepare and eat dinner, clean up the kitchen, which is, again, a part of their schedule. You can talk and reminisce over dessert, play cards, watch movies, take a bath. And then that's when you start to get ready for bed. And then they may be able to read a book in their room or whatever have you they want to do. But we want to make sure that they have some type of schedule that they're following so that they won't feel lost. Now, since we've been in quarantine lately for the COVID-19, you're going to have to start incorporating more hand washing to make sure that they are staying safe. And a lot of times they don't wash their hands as much at home. So what you can do, and you can incorporate it in your morning routine. First, if they don't understand, you can teach them hand washing, and you can also sing a song with them. So whatever song that they like to sing, you can have them sing it while they're washing their hands. Make sure after they eat breakfast, they're going to wash their hands again. And again, we're going to go through all of those different activities that they're able to do. And after they go outside and they come back in, make sure they wash their hands again. Washing their hands is probably the biggest way to reduce the spread of this virus. During meal times, they may have swallowing difficulties. So if they have not already seen a speech language pathologist and they haven't changed their diet to something that's softer that they can eat, these are ways that you can help if you've noticed that these are the things that's going on within their swallowing. So if they're having difficulty chewing or biting certain things, so say they chew for a very, very, very long time, or they stuff a lot of things in their mouth and they're unable to swallow and they take it out. Or if you see that they're putting the food in and sucking on the juices and then taking it out, that is not normal. That means that the food is too hard for them to chew and they're unable to swallow it, and so they're taking it out. So that may mean that they need a softer diet. Frequent throat clears. So if they are clearing their throat after they swallow, that's a red flag. Coughing before, during, or after their swallow, that is a red flag. You should not cough after you swallow. If they are noticing these are things that you need to make sure you take a note of so that you can tell the doctor in the future. If they're drooling, if they're unable to manage their secretions, that's another red flag. And feeling of food stuck in their throat. If you see any of these signs or symptoms of dysphagia, be sure to refer them to their primary care doctor. So if you are seeing these symptoms and signs and you're unable to get into the doctor right away, these are some strategies you can use to help you. Make sure the food is softer. So you may need to blend the food in the blender just to make it a little softer, or add broth to it, or add butter to it, add ketchup to it, add gravy. They may need an emulsifier to make sure that they stay together. Make sure that the bites they are taking are smaller. We don't want to stuff the mouth too much. If they stuff the mouth too much, they're unable to swallow again. And so again, they're going to have to take the food out. So make sure the bites are smaller, or you can even cut the pieces for them so that the pieces are not as big. Always encourage taking sips of liquid after they're swallowing. So say they take 2 or 3 bites, have them swallow and say, okay, let's take a drink. That's going to allow for the food to go down and have a chance to reset so that the muscles are not as weak when they come back for the next bite. Make sure they don't talk while they're eating. Will put them at risk for choking, and you don't want them to choke. So be sure to talk to their PCP or for referral for speech therapy if you're seeing any of those signs and symptoms, and if you're having to remediate some of their foods. Lastly, make sure you are safe. Make sure your family is safe, and be patient. This is new to them. Hello, I hope that this presentation gave you a little more perspective into how to identify and deal with patients or family or loved ones with dementia and Alzheimer's, and what to look for. So if you see these things, make sure you go to them to the doctor, because they may not know. They may just say, oh, that happens all the time. Oh, I do that all the time. These things are not normal, and they need to be addressed. And there is someone that is there that can address those things. So make sure you go to the doctor and you say, hey, I've seen these things, and they may need a speech pathology referral. And that way they can get the help that they need. I hope these are very helpful for you, and you have a very, very blessed day.